Hi, I'm Dr Bianca Le Feuvre and I'm a GP with a special interest in aesthetic medicine. I have a clinic called Elfin Aesthetics in Constantia, and I will be chatting to you today about Botox and whether it's the right treatment for you in your 50s. And good news, there is no upper age limit to when you can have Botox treatments done. Before I move on to a better question I think to ask, I'm going to chat a little bit about Botox. Most of you know the name Botox and you think it's actually the treatment, but in fact it's actually a brand, like Hoover is a brand of vacuum cleaners. Dysport is another brand just like Botox, and I actually regularly use that in my clinic. Both Botox and Dysport are medications that target overactive muscles and relax them. It takes a few days for them to have effect, and usually the results last for 3 to 4 months. Now moving on to a better question, I think it's important to ask, is Botox the right anti-aging treatment for me? It's easy to look at our friends and see what they're doing and what does and doesn't work for them, and then decide on a treatment plan for ourselves. But actually we are all so unique, and we need to have a full face assessment and have a plan to what's going to be the best thing for us at our age. There's no doubt that Botox and Dysport have dramatic, dependable results. It's a quick treatment and there's almost minimal downtime. It has dual benefits of having you look great now, as well as preventing wear and tear for your future self. Now, I've just told you there's no age limit to having Botox, and the results are fantastic. So why aren't we injecting it all over our face? Unfortunately, there are some drawbacks to having Botox injections. They can only treat certain lines, so we call them dynamic wrinkles, wrinkles that are made on movement. If you have too much injected, you can have a frozen blank sort of expression. Botox won't plump out skin or smooth out deeply etched lines. One of the uncommon side effects of Botox, which is the dreaded drop brow, actually becomes more common in the 6th decade onwards. The reason is that as we age, the frontalis muscle that holds up our eyebrows actually becomes thinner. Our skin becomes thinner and we sag. So it's quite natural as we age for our brow position to drop a bit. If we then go and inject Botox into this muscle, we take away the muscle that's actually holding up the eyebrow. Let me use myself as an example. I'm 40 this year and I have naturally low set eyebrows. I don't inject myself in the same way I did when I was 30. I spread out the units more so that there's less effect just above the brow, so that gives me enough lift. At this stage, the lines in my forehead are more bothersome to me than the risk of a drop brow. But I'm sure in 10 years' time, I'll either decrease the dose quite dramatically or I'll stop injecting my forehead altogether. For me, the vitality of the whole face is way more important than erasing a few lines. And this is generally my approach for all my patients who are in the 3rd stage of life. So now I've told you, A, there's no age limit to having Botox. B, the results are fantastic. And C, some things can actually go wrong when you have it done. So it makes you think, well, why are you telling me about it anyway? But the reality is there's still a place for Botox in your face from your 50s onwards. For me, the prevention is always important. However, when you're in your 50s, it's so important to build the skin scaffolding. And I just want you to be aware that you're probably going to rely a lot more on dermal fillers and skin boosting treatments to get your natural looking results. Unless you've been doing treatments regularly up until now, Botox just won't be that miracle drug that fixes all. And whilst I'm chatting about Botox today, it's always good, now that I've given you this prompt that you're probably going to need some filler or skin treatments, it's good to know that there are other options. So with the forehead lines, if they really bother you, but when you've had Botox, your brow gets a little heavier, there are things you can do like mesotherapy or skin boosters, which skin boosters are very thin fillers that actually add more packing to your skin. Because we're not moving more than we moved when we were children. But as children, we had this thick skin, so we didn't see as much wear and tear in the face. So you can use your mesotherapy or skin boosters to plump that skin back and really rejuvenate the face without really having to use Botox in the forehead. As a side note, and I feel it's important to mention, especially with the pandemic we've just gone through and the increased stress we're seeing with just people generally, I'm having a lot of referrals from dentists for Botox treatments for teeth grinding. And not a lot of people realize that Botox isn't just used for cosmetic reasons. We actually inject it into your overactive jaw muscles to help relax them. Now, it doesn't take the action away completely. You can still chew, still do what you need to with the face, but it just stops that excessive action that just leads to chronic tension in the face. It can lead to damage of your teeth. And we just really are seeing this a lot, especially in this stressful time. Botox has a lot of medical uses. And another interesting fact is that there's a lot of research going on for the use of Botox for depression, that a few psychiatrists noted that when you injected Botox into the frown lines, their patients with depression actually showed a marked improvement. So there's a lot of unknowns with Botox and benefits we're going to keep seeing in the future, which is exciting. Other interesting place for Botox is excessive sweating. I use it for the underarms. At times I'll use it for excessive sweating in the hands or the feet. I have some patients who sweat profusely on their face, and we have techniques where we can just isolate areas and do it quite superficially, so we don't get the risks of a dropped brow, but you do get a reduction in the amount of sweat produced. Although they say when you hit menopause that migraine should actually peter out, there are a lot of people that struggle continuously, especially with tension-triggered migraines. And Botox is FDA approved for the management of chronic migraines, and generally it reduces the migraine days by half in patients who suffer with chronic migraines. I use it for for chronic tension in the necks. I have patients who've had physio and chiro for years, but they can't seem to release a chronic knot. And I find it's not a curative treatment, but it just helps relax the area so that the treatments you're doing with your physio can just have more effect. As always, with my ethos for my practice, and definitely the ethos of Evie magazine, this information is not to bring fear into you about, oh, I should be doing these treatments to age better or keep up. It's really just to empower you that you are worthy of self-care, and there are things you can do to just improve both your quality of life and appearance, so you feel like you're going into this world and just feeling confident and just really comfortable in your skin.